Hello and welcome to Achievers Hive, dear learners. Today we are taking some higher order mental level questions from the topic psychological disorders. This question paper is useful for all those who are preparing for CUET, for undergraduate program, for postgraduate program too, and any other exam in which psychological disorder is a topic. So you can get this PDF from our Telegram channel. You will get a detailed explanation of the options, of the questions and everything included in this PDF. So let us quickly begin with the explanation, discussion, everything. Question number 1 is right in front of you. Feeling of apprehension due to the anticipation of danger is known as what? We have 4 options here: fear, anxiety, depression and stress. The answer for this question is anxiety, because anxiety is known as feeling of apprehension due to the anticipation of danger. When people feel that there is some danger around them, they first of all they get associated with anxiety, right? So this answer, anxiety, has to be the correct answer for this question number 1. Coming to question number 2, persistent and disproportionate fear of some specific object or situation that presents little or no actual danger to the person. See, focus on this line, that presents little or no actual danger to the person. So that means in actual the scenario is not there, the fear is in the mind. There's something which is related to the, you can say, disproportionate, or you can say irrational fear to that. So that particular term is known as phobia. So the correct answer for this question is phobia. Question number 3, mood disorders are formerly known as what? Since mood is the word that is somewhere associated with affection, emotions, or you can say emotions, right? And emotions are associated with affections. So the answer for this question has to be affective disorder. But this is not that we are just connecting a link. It is because in depression we can see the declination of the mood. In anxiety disorder there is nothing related with the mood. In somatoform there is nothing related with the mood. So the answer has to be affective disorder. We are actually filtering the answers, filtering the options as well. Question number 4 is there, and the question is, which disorder is formerly called as Briquet disorder? So for that, either you have to learn which disorder is known as Briquet disorders. So we have 4 options: somatization disorder, pain disorder, hypochondriasis and mania. So let me show you first of all what the correct answer for this question. The correct answer is option A, somatization disorder. So we need to know a little bit more. Just as you can see, pain disorder, it's associated with the pain that people feel. Mania, in which people feel mood disorder, right? And now we are coming to the hypochondriasis. Another name for this is illness anxiety disorder, and another name for Briquet disorder is somatization or somatoform. So if you remember this, it can be useful for you. These terms can be asked anywhere. It is generally asked. And hypochondriasis is also asked that what is the other name for it. So you get 3 questions here. Coming to the next question, preoccupation with certain aspects of the body, OCD, GAD, BDD, PTSD. We need to know what these terms are. OCD, obsessive compulsive disorder. Let me take you to the question again. Preoccupation with certain aspects of the body. When it is about people get preoccupied with their body, it cannot be OCD, because obsession compulsion are somewhere related to the cognitive behavioral disorder. GAD is generalized anxiety disorder, so that is again not associated with the aspects of the body. BDD stands for body dysmorphic disorder. You need to know the full form of all these as well, then only you will be able to explain it. So BDD is body dysmorphic disorder. We somewhere feel like that C should be the answer, but let's see what PTSD, post traumatic stress disorder. So that is definitely not the answer. Option C is the correct answer for question number 5, that is BDD, body dysmorphic disorder. Question number 6, in one's sense of self is temporarily lost. In which among these the sense of self is temporarily lost? So depersonalization, derealization, hypochondriasis, anxiety. See, just before I have explained you what hypochondriasis and anxieties are, so we will be coming to the other 2 options, depersonalization and derealization. In depersonalization, the sense of self is temporarily lost. In derealization, the sense of others, that we are associated with others in this world, this sense is lost in derealization. So actually you can understand the sense of self at personal level in depersonalization and at social level in derealization. But since one's sense of self is asked in this question, so option A has to be correct option. Coming to question number 7, failure to recall previously stored personal information, like problem of forgetting, to which you also know as a problem of forgetting, that is known as amnesia, and the proper name for this is dissociative amnesia. So the correct answer for question number 7 has to be dissociative amnesia, which means flight, fugue, amnesia, projection, relapse. So here you can see that relapse is a new term for you. If you have studied it, very good, very well. But if you have not studied, I'll explain you later. Projection, you know what projective techniques you have understood. So projection means to post put the blame on someone is like projection. Amnesia, we just now have understood that amnesia is a problem of forgetting. Fugue is the correct answer for this, but we need to know what relapse is. The general meaning of relapse is a deterioration in health status after an improvement. It can be physical, mental, emotional, behavioral. Like when someone gets admission into a rehabilitation center, but after a few days the person want to go back to take their drugs, right? So that is a state of relapse. Or we can say when there is a medication going on for some person, but when they come back to the previous stage, this is known as relapse. Which is an example of behavior therapy? Answer you have seen on the screen. So flooding is the example of behavior therapy, but we need to know what flooding is, right? Dream analysis, was given in psychodynamics by Sigmund Freud. Psychoanalysis, again, counseling is a general process. So what flooding is? In psychology, flooding, which is also known as implosion therapy, is a type of exposure which works by exposing the patient directly to their worst fear. It is, you can say, the next step to systematic desensitization. But in systematic desensitization, there's a hierarchy which is followed. But in flooding, the person is directly taken to the fear they experience. But do you think it is really easy to apply? So it's not that easy. So for that, the person or the client is first of all being prepared for it. You can just read this paragraph, you will understand it, that people are first made to prepare for it, then only uh, they are able to just get into the fear evoking stimulus. So this is known as flooding, and the answer was it is an example of behavior therapy. Again, along with this question, let me tell you that systematic desensitization is also an example of behavior therapy. So here you get two questions. Coming to question number 10, overt repetitive behaviors are more covert mental acts. Which one among these? Question number 10 is right in front of you. You can see which overt repetitive behaviors or more covert mental acts these are. So the answer for this question is compulsions. Study of the distribution of disorders in a given population is known as what? The term 1, epidemiology, is the correct answer for this. This is the branch of medical science that investigates all the factors that determine the presence or absence of diseases and disorders. So epidemiology is the field in which the distribution of disorder in a given population is being studied. We have given another terms explained here: prevalence, prognosis, relapse. Since these were used in these questions, so these have been mentioned here. You can read it later from the PDF. Please go to the Telegram channel, there you will find this PDF and you can download it from there. Question number 12, the primary method of treatment for demonic possession was which one? Exorcism, mass madness, psychotherapy, or flooding? Answer is exorcism. Who believed that hysteria is caused by the uterus? Four names are given to you: Aristotle, Plato, Hippocrates, and Morgan. So the answer for this question is Plato. Conversion disorder, which used to be known as hysteria, is a type of mental disorder in which a wide variety of sensory, motor, or psychic disturbance may occur. The term hysteria is derived from the Greek hystera, that means uterus, and reflects the ancient notion that hysteria was a specifically female disorder resulting from disturbance in the urinary functions. So the answer is Plato. A condition in which people believed themselves possessed by wolves. There are four options given to you. Lycanthropy is known as a condition in which people believe themselves possessed by wolf. We have mentioned it here. It's a mental disorder. Other than this, folklore is also the magical power to transform oneself or another into a wolf. This is a kind of delusion disorder in which people feel like this, that they have gained the power of a wolf. Coming to question number 15, which refers to the presentation of a wide range of noxious stimuli with alcohol consumption in order to suppress drinking behavior. You are given four options here. So the correct answer for this question is aversive conditioning. You have also studied in NCERT that what aversive conditioning is. Who is the founder of American psychiatry? You are given four options for this. This you will have to learn that the answer is Rush for this. Dr. Benjamin Rush. You can read more about him. He is also known as father of American psychiatry, and he has done a lot to this psychology. You can read all this from the PDF. Again, I would mention it. Who is the person behind the rise of mental hygiene movement? There are four options given to you. Read the options, go to the correct answer. Dothoria Dix is the correct answer for it. You can read all this right here from the screen, or you can go to the PDF. You can get all this stuff. Which one is the odd one? Sublimation, displacement, hallucination, rationalization. Other than hallucination, all others are, these ego defense mechanism, and hallucination is a disorder. So it is the odd one out. Free association is dealt with which one? Behaviorism, mesmerism, psychoanalysis, or functionalism. So psychoanalysis you have studied, so correct answer is this. But you might feel what mesmerism is. So it is a hypnotic induction practiced by F.A. Mesmer, and he applied this on animals. You can also understand in this way that mesmerism is a kind of animal psychoanalysis. This is the easiest way one can make you understand. In some countries, it is normal to defecate or urinate in public. This makes it clear that judgments on the normality of behavior are culturally relative. You have seen the answer on the screen. Who is the father of behaviorism? Four options are given to you for this. The correct answer for question number 21 is John B. Watson. He is known as the father of behaviorism. Again, you will have to remember who put forward operant conditioning: Wolf, Pavlov, Skinner, and Bandura. Skinner is the one who has put forward operant conditioning, process by which stimulus increases the probability of desirable behavior. Only by giving the reinforcement it is possible that we can increase the probability of the desirable behavior. So correct answer is reinforcement. Sensory experiences that occur in the absence of a stimulus are known as what? Sensory experience. They are hallucinations, because only hallucinations are the sensory experience in which we feel that something is happening. You feel like that you're listening to someone but nobody is there. You feel like you just saw something but nothing is there. So these all known as are hallucinations. So answer is hallucination. An Austrian physician who conducted early investigations into hypnosis as a medical treatment. What is the correct name for him? You have to remember this. Anton Mesmer is the correct name. He is the Austrian physician who conducted early investigations into hypnosis as a medical treatment, and also he applied it on animals. So this also you have to remember. Who propounded psychoanalysis? Very popular name, most popular, Sigmund Freud. Condition in which person is intentionally producing or grossly exaggerating physical symptom that is motivated by external incentives. There are malingering, factitious disorder, somatoform disorder, dissociative disorder. Answer is factitious disorder. This is a condition in which the person deliberately and consciously act as if they have a physical or mental illness when they are not really sick. So this is known as factitious disorder, and other things are also given about factitious disorder. This is a proper explanation for this. You can get this, or you can read it here just by making a pause in the video, or you can also go to the Telegram to download the PDF. Question number 28, partial or total inability to recall or identify previous acquired information or experience. So two type of amnesia is mentioned, then other two disorders are there. So this is known as retrograde amnesia. So we have explained here what retrograde and anterograde amnesia. Retrograde amnesia, when you can't recall memories that were formed before the event that caused the amnesia. And interrogate amnesia describes amnesia where you can't form new memories after the event that caused the amnesia. So question number 29 is easy for you now. Partial or total inability to recall or identify new information would be what? Interrogate amnesia. What is the legal term for mental disorder? It is insanity. Remember that it is a very important question. It is generally asked in the PG examinations when you're preparing for the post graduation level exam. So the legal term for mental disorder is insanity. Coming to, you can read all this paragraph from here. You will get to know why insanity is known as the legal term for mental disorder. You can pause the video here, read it, and then otherwise you can download the PDF. Emotion or feeling is otherwise known as what? This is known as affect. I just told you in the beginning that affection is also associated with emotions. Okay. Dysthymia, we have discussed what it is. You can read it. Institutions meant solely for the care of the mentally ill during ancient times were known as what? Asylums, mental hospitals, shrines, or church. So the correct answer is asylum. Discharge of emotion associated with something. This is known as catharsis. This is the definition of catharsis. The discharge of emotions that is associated with something. Convergent disorder and hypochondriasis are classified as which kind of? So these both are known come under this somatoform disorders. Okay, you have to remember this. This is a very common question. Question number 34, which is generally asked. In most anxiety disorder, the person's distress is focused on a specific situation related to ordinary life stress, greatly out of proportion to the situation based on a physical cause. So the answer is greatly out of proportion to the situation. So these were some questions we discussed in this class. Hope you would have understood the content and you would have liked it as well. Please download the PDF from the Telegram. I'm just repeating. And subscribe to the channel if you have not done it yet. Please share it among your friends so that they can also practice something. See you soon in the next video. Till then, take care. Bye bye.